What psychological challenges face investigative journalists? Imagine spending your days uncovering secrets that powerful people want to hide. It sounds exciting, but it can also take a toll on your mind. Investigative journalists face many mental hurdles because of the work they do. They often see distressing content like violence, corruption, or abuse. Repeatedly hearing traumatic stories can lead to vicarious trauma, which is when you feel trauma symptoms just by hearing about others' experiences. Studies show that where journalists have PTSD rates as high as 28.6%. Depression is common too, affecting over 20% of those in the field. Sadly, many journalists get little support or counseling to handle these emotional impacts. They also deal with high anxiety and feelings of guilt or anger, especially when they see injustice or unethical behavior. Sometimes they experience moral injury, which is distress caused when their work conflicts with their personal morals. Online threats and harassment make things worse, often leading to severe anxiety or even PTSD symptoms. These threats can be persistent and frightening, making journalists feel vulnerable and unsafe. The feeling of being targeted can cause constant stress, which affects their mental health over time. Burnout is another big issue. Long hours, tight deadlines, and unpredictable work schedules leave journalists exhausted. They often struggle to balance work and personal life, which can lead to emotional fatigue. Listening to traumatic stories repeatedly can also make them feel helpless or emotionally drained. Over time, this can cause emotional exhaustion and a sense of being overwhelmed. Many news organizations do not provide enough mental health support. Some journalists feel they must hide their feelings, especially older ones who grew up in a culture of toughness. Access to therapy or counseling is often limited or not encouraged. Recognizing the signs of anxiety, depression, or trauma early is important. Seeking support can help journalists manage their emotional health better. News organizations should offer training on mental health risks and provide counseling services. Developing coping strategies like setting boundaries and finding safe ways to process difficult content can help reduce burnout. Talking openly about mental health within teams can also break down stigma and promote well-being. Understanding these psychological challenges is key to helping investigative journalists stay healthy while they continue their vital work.